Assalamualaikum and greetings to everyone. My name is Nur Aisha binti Ashar, and today we will present our poster which is about hemochromatosis. Hemochromatosis, also known as iron overload, is a condition in which the body retains an excess of iron. It is typically genetic. This accumulation of iron, known as iron overload, can induce unpleasant symptoms. If left untreated, it can cause harm to the liver, joints, pancreas, and heart. Although the disease cannot be prevented, early detection and therapy can help avoid, reduce, or reverse organ damage. Why is too much iron dangerous? Too much iron can be toxic. In the heart, it can cause arrhythmia or heart failure. Meanwhile, too much iron in the liver can lead to cirrhosis, enlarged liver, liver cancer, or liver failure. In addition, iron overload can cause arthritis, diabetes, problems with the spleen, renal gland, pituitary gland, gallbladder, or thyroid, as well as problems with the reproductive system, such as erectile dysfunction in men and early menopause in women. In certain cases, patient's skin may also look noticeably more gray or burnt than usual. If this condition is not treated, it can lead to death. Hemochromatosis is more common in white Northern Europeans, especially in Celtic majority countries such as Ireland, Scotland, and Wales. For examples, 1 in 83 Irish reports to develop hemochromatosis, and 1 in 130 Scottish develop hemochromatosis, and 1 in 115 Welsh are also expected to develop hemochromatosis.
Assalamualaikum and hi. My name is Nurin Aini binti Muhammad Nasri. I'm going to explain about types of hemochromatosis. There are two types of hemochromatosis, each with different causes. The first one is primary hemochromatosis, also known as hereditary hemochromatosis or also called as classical hemochromatosis. And the second type is secondary hemochromatosis. For primary hemochromatosis, it is the most common form and the most prevalent. There is an inherited genetic alteration. It also occurs when DNA issues arise from both parents, causing the body to absorb an excessive amount of iron. For the second type, which is secondary hemochromatosis, it is an iron overload that is due to medical conditions or external factors. This iron overload is due to blood transfusion, long-term kidney dialysis, and also iron supplements. Assalamu. Next, I will explain about hemochromatosis symptoms. We should know that not all people with hemochromatosis experience symptoms. Some persons with high iron level might not have any concerns, while others get severe symptoms. People may develop symptoms typically appear later in life, usually around the age of 40 in males and 60 in women. Women are more prone to experience symptoms after menopause when they no longer lose iron through menstruation and pregnancy. The symptoms that people around this age may include: first, fatigue. Second one is iron risk or pain in the knuckles of the pointer and middle finger. And the third one is joint pain. Or fourth, people may have rosy or gray skin due to deposit of iron in skin cells. Fifth, there will also develop liver failure. And the sixth one, brain fog that feel like mental exhaustion and inability to concentrate.
Hi and Assalamualaikum. My name is Nur Aikala binti Zainuddin. So now I will explain about the genetic cause of hereditary hemochromatosis. So, what is hereditary hemochromatosis? Hereditary hemochromatosis is a genetic disorder that caused by a change at the HFE gene, which is located at the chromosome 6. This altered gene can cause our body to absorb too much of iron from our diets. So, how is the gene passed on? Generally, genes come in pairs, one from each parent. If both of the parent has the abnormal or altered gene, then the child or the children will inherit two altered gene. But if just one of the parent that has the altered gene, then the children will inherit just one altered gene. If we dive more into this genetic inheritance, there are actually three types. The first one is homozygous. If a child inherits two copies of C282Y mutation from both parents, this condition called as homozygous. This is the most severe form of hereditary hemochromatosis. The second one is compound heterozygous. If a child inherits just one C282Y mutation from one parent and one H63D mutation from the other parent, then this condition called as compound heterozygous. This is the second most severe form of the hereditary hemochromatosis condition. And lastly, heterozygous. If a child inherits just one altered gene, either C282Y mutation or H63D mutation, then this condition called as heterozygous. This is of the least severe form of hereditary hemochromatosis, and the person usually just a carrier with a lower risk of developing severe symptoms. So, you must have wondered, what is C282Y and H63D mutation? These two are actually two common type of mutation that happen to HFE genes. So, C282Y mutation. This mutation substitute the amino acid of cysteine to tyrosine at the position of 282 in the protein change. This substitution disrupts the formation of crucial disulfide bond, which is required for a proper protein folding. Thus, this causes alteration or misfolding of the HFE protein. Then, the misfold HFE protein cannot be transported to the cell membrane or cell surface. Thus, it just retained at the endoplasmic reticulum and being degraded over time. While for H63D mutation, this mutation replaced the amino acid of histidine to aspartame, or also known as aspartic acid, at the position of 63 in the protein change. This change likely altered the three-dimensional shape of the HFE protein, also caused misfolds of the HFE protein, but they are less severe than C282Y mutation. Thus, it just reduced the function of the HFE protein, but it still can be transported to the cell surface and being present at the cell surface. So now I will explain about the mutation impact of hereditary hemochromatosis. This mutation will prevent the HFA protein from interacting properly with transferase receptor 1 and other protein including hepcidin, which is a major regulator of iron in our body. This impaired interaction causes disruption of the iron sensing mechanism. Because of the HFE protein is either absent or dysfunctional, it cannot send the right signal to produce or to stimulate the production of hepcidins. This results in reduced hepcidins level in our body. As a result, iron regulation is disrupted and too much of iron are being absorbed from our diets, or more specifically from our intestine. This leads to iron overload, where excess iron is being stored or accumulated in various organs including liver, heart, and pancreas. Over time, this iron overload can cause damage to this organ and leads to conditions such as liver disease, heart problem, and diabetes.
Moving on to the next part, I am Nurina Hadira will be presenting on the diagnosis of hemochromatosis. Hemochromatosis can be diagnosed through a combination of blood tests, genetic tests, and also imaging tests for certain conditions. Hemochromatosis can be difficult to diagnose, but early symptoms such as stiff joints and fatigue may be occurred due to the conditions other than hemochromatosis. Several blood tests that will be performed in order to diagnose the disease include serum ferritin test, total iron binding capacity test or TIBC, serum iron test, and transferrin saturation test. A serum ferritin test result indicating hemochromatosis typically shows significantly elevated level with a value above 300 mg per ml in men and above 200 mg per ml in women. However, a high ferritin alone is not definitive and further testing like transferrin saturation is needed to confirm the diagnosis of hemochromatosis. In TIBC, total iron binding capacity test, for someone with hemochromatosis, the result will typically show a low TIBC value alongside with high serum iron level, indicating an iron overload condition where the body has too much iron stored within it. TIBC range from 200 to 300 mcg per dl in hemochromatosis affected patients. For further confirmations, a doctor also may recommend a liver biopsy if blood iron levels are high, especially if the symptoms are consistent with the hereditary hemochromatosis. Other than that, genetic testing such as HFE mutations analysis is also recommended to examine the HFE genes for specific mutations, primarily in C282Y and H63D variants. These tests can determine if someone has an increased risk of developing hereditary hemochromatosis. And lastly, we have MRI liver multiscan. It is a non-invasive imaging technique that measure liver iron concentrations (LIC) in patients with hemochromatosis. It's also considered to be a gold standard for diagnosing in iron overload in the liver.
Assalamualaikum and hi, I'm Nur Zulaika. I'll be concluding our presentation by discussing how this condition is managed effectively to prevent long-term damage and improve patients' quality of life. The primary treatment for hemochromatosis is venesection, also known as phlebotomy. This procedure involves removing blood from a vein, typically about 500 milliliters, which also removes iron-rich red blood cells. The body then uses stored iron to produce new red blood cells, gradually reducing iron levels. Phlebotomy treatment occurs in two stages. The first stage is the induction phase. It involves frequent blood removal, often weekly, until iron levels return to normal. This process can take up to a year or more, depending on the severity. Once iron levels are stabilized, patients enter the maintenance phase, requiring blood removal every 2 to 4 months for life to keep iron levels in check. Phlebotomy is a very effective treatment and is the main method used to manage hemochromatosis for most patients. For individuals who cannot have phlebotomy, such as those with fragile veins, chelation therapy may be used as an alternative. Chelation therapy involves the use of medications that bind to excess iron in the bloodstream, allowing it to be excreted through urine or stool. Common medications for this treatment include deferoxamine, an oral medication, and desferrioxamine, an injectable medication. However, it is important to note that deferoxamine is not officially licensed for the treatment of hemochromatosis due to limited clinical trials, but may be prescribed if necessary. Another important aspect of managing hemochromatosis is dietary modification. Patients are advised to maintain a healthy and balanced diet. They should avoid iron-fortified foods such as cereals with added iron and refrain from taking iron or vitamin C supplements, as these can increase iron absorption. Additionally, patients are encouraged to avoid consuming raw oysters and clams, which may contain harmful bacteria. Limiting alcohol intake is particularly important as excessive alcohol can increase iron levels and strain the liver, which may already be compromised. In summary, the management of hemochromatosis involves a combination of medical treatments and lifestyle adjustments. Venesection remains the primary treatment for most patients, with chelation therapy serving as an alternative when needed. Dietary changes and alcohol moderation also play significant roles in controlling iron levels and improving overall health. These strategies, when followed consistently, enable patients to lead healthier lives despite the challenges of hemochromatosis. Thank you for your attention.